Good evening, friends. On behalf of Zygon Academy of Training for Embryology, I welcome you all. I am Dr. Dharmesh Kapadia. Today we'll be talking about sperm preparation for IUI. Now, why do we need to process the semen for IUI? The sperms are usually in protective non-labile state at the time of ejaculation. So they have to get separated from the seminal plasma, and that's how they acquire fertilizing ability, and that is called the capacitation. Next slide, please. Now, if we take little longer, the sperms are there in the seminal plasma, in the semen, and we take it little longer before starting the procedure of washing it. What happens? That can cause decreasing the fertilizing ability of the sperm. Now, the problem with washing, what harm it can do? When we are centrifuging this semen, usually the dead sperm, immotile sperm, poorly motile sperm, leukocytes, they all tend to produce ROS, that is called reactive oxygen species, and they can cause damage to plasma membrane and DNA. So what is our aim of doing IUI or washing? To remove seminal plasma and dead sperms and to concentrate motile sperms that we can inseminate in the uterine cavity. Next, please. Now, once we have decided, okay, we need to do IUI or semen processing. Now, how do we decide which method to be used? Conventionally, there were 2 or 3 methods they were used. First is sperm migration. The conventional name is swim up. Second is selective washing. It is called density gradient. The third one, which is not a lot commonly used, but it is simple dilution and washing. Next, please. Now, how do we select whether we need to do swim up, we need to do density gradient, or we need to do simple washing? So if the count is good, motility is good, ideally we are not supposed to do IUI with these patients, but still if we are supposed to do, then any of the method you can do is swim up or density gradient. If the count is low, if it is 5 to 15 million, then density gradient is the treatment of choice. And if the count is too low, less than 5 million, ideally, again, IUI is not indicated for such patients. These are the patients, they can be recruited for the ART treatment. Next slide, please. So, if we have decided to do swim up, now let us come to the principle. Now, what happens in the swim up? The concept in swim up is we try to accumulate all the sperms, good sperm, bad sperm, dead sperm at the bottom in the palate. And from that, we allow only good sperm to get separated as they swim up. That is the principle behind it. There are 2 techniques in use, overlay and underlay. Commonest is overlay, which I am going to explain. Next, please. Okay, so this is graphical presentation, how we do. So we take a test tube, we put all the semen. Once it is liquefied, we add equal amount of pre-equilibrated washing media in it, mix it properly, don't make bubbles, and then put it for centrifuge for around 12 to 15 minutes at around 800 to 1200 RPM. After 12 to 15 minutes, when we take out the test tube, what we can see is there are 2 layers. The basic, at the bottom you can see a white palette. These are all the sperms, good sperm, bad sperm, dead sperm, immotile sperm, and above is the seminal plasma. So the next step is removing the uppermost layer, that is seminal plasma, and keeping the palate intact. So slowly we will be slanting it, removing the uppermost layer of the seminal plasma and not to disturb the palate. After that, now the palate is having all sort of sperms, good sperms, bad sperms, immotile sperms. So what is our interest is good sperms. So we will overlay 0.5 to 0.7 ml of media, and we will wait, or we will put it for the next process for 45 minutes. So what happens? All the sperms, the good sperm, will try to reach the uppermost layer, that is called swim up. And once all the sperms are there at the uppermost layer, then after 45 minutes, we'll take this upper 0.5 to 0.7 ml. Again, here you are not supposed to disturb the palate, because again if the palate is mixed, the whole process goes in vain. So whatever 0.5, 0.7 ml you take from the supernatant, that is going to be rich with very good quality sperms, good motile sperms that we can use for insemination. Next please. So this is the way all the sperms from the palate, they travel till the uppermost layer. Now some prefer direct swim up method. As I have discussed, when we try to centrifuge all these sperms with leukocytes and date sperms and everything, they have more tendency to produce ROS. So what some guys do, they take the semen, they overlay straight away the media, 0.2 ml of media over it. So they don't do any washing to this unselected sperm. So all the good sperm, good motile sperm, they try to come in that 2 ml of media. After 35-45 minutes, they take out the upper 2 ml of media, which is again going to have good sperms only. Then they do one wash. So this is another way. And why they do is because when we try to centrifuge all these sperms together, again as I have told you, they produce ROS theoretically at least, and they can impair the fertilizing ability. Next step. Next is density gradient. So what is the principle behind it? Sperm specific gravity and the centrifugation force causes sperms to move down all the gradient and they reach till the bottom. And all the immature sperms, those who don't have the capacity to cross that barrier, they are filtered in between. Next slide please. Okay, so again graphical presentation. We take a test tube. There are two types of density media available, single density and double density. Commonly practiced is single density. So if you are taking a single density, we will take single density medium and we will overlay semen over it. If it is a double density gradient, first we will take the higher concentration density, then lower concentration density, and above that semen. After that again we will centrifuge for 10 to 12 to 15 minutes for 800 to 1200 rpm. So after 15 minutes, what we see is three distinct layers we will see. The uppermost layer is seminal plasma. The middle fluffy ring you can see very clearly. That is all the dead immotile sperms which have tried to cross the barrier but which couldn't. So they make a fluffy ring. And the lowermost part that contains the density gradient plus good sperms which are of our interest. So we will be removing the upper two layer, leaving a test tube with the lowermost layer which is density gradient and good sperm. Now again this we cannot put straight away in the uterine cavity. The reason being, it is not only the sperms but the density, a lot of density particles are there. So the next concept is separating them as much as we can. So what we will do, all the density medium, the kit comes with the washing solution. So in this we will add 5 ml of washing media, pre-equilibrated washing media. Again we will centrifuge for 5 minutes. So what will happen, all the sperm will try to reach till the bottom, again the same way, and after 5 minutes we will, whatever the solution is, we will be removing the uppermost layer, leaving 0.5 to 0.7 ml of media which is at the bottom. So this is the media which contains the washing medium, the good sperms and little bit of density particles, and this after checking its count and motility, again we can use it for insemination. Next slide please. Simple washing, again as I have told you before, 5 million, 6 million, 3 million, they are the cases to be recruited for ICSI, ART and ICSI. But in Indian scenario, when the patient is poor, they are not affording ART treatment, a lot of times we are supposed to do this procedure. So in that case, if you try to do swim up, all the sperms, because the swim up concept is the good motile sperms, they reach the uppermost layer. Here we are lacking the sperms, the motility is supposed to be bad. So you are not going to get anything. Again, if you do density gradient, they are not going to cross the barrier. So what we have found out the intermediate way, that is called simple washing. What we do is, we do the half of the process what we do for swim up. So we take the semen, mix it with pre-equilibrated media, mix it properly, go for centrifugation. Once centrifugation is done, then we remove the uppermost layer, seminal plasma, and whatever the palate is there, with that 0.5 to 0.7 ml of washing media, we mix it and we put it in the uterine cavity. The good part is we are concentrating the sperms. The bad part is about this is that it is going to be mixed with lot of bad sperm, immotile sperm, maybe leukocytes. So not the ideal most method though. Now there are few salient points. Back please. That is how we can go ahead. Pre-equilibration of media, very important. You are supposed to do semen processing. Your gynecologist has sent the patient. You take out the media from the freeze and you utilize it. No, it has to be pre-equilibrated at least for an hour or two. The temperature of that media has to be around 32 to 34 degrees Celsius at least. Laminar flow to be used. Why? Because we have to keep the environment sterile. Air bubbles, very important. Because whenever we are doing this procedure, whenever we are mixing the semen with the media or we are aspirating, we tend to produce bubbles. They are the biggest enemy of any embryologist. So what is important is you should not be making a lot of bubbles. And if you make it, then you are supposed to remove it, all the bubbles, before you put it for centrifugation. For this swimmer palate not to be disturbed, because you have removed the uppermost layer. While doing this, if you by mistake mix it, then the whole process goes in vain and then again the purpose is not served. The last one is very important. You are ready with all your procedure, you are very happy, you have done fantastic work, the sperms are ready, motility is good, everything. You ask the gynecologist to inseminate, but he or she is busy with his work. So then you have to intervene, you have to push them that once the process is done, it is ideal to put all these sperms inside the uterine cavity as early as we can. So push your gynecologist so they finish up the IUI process and then you are free. Next. So guys, in brief, I have tried to convey my message about or my views about how we can perform IUI. Views differ, but this is the way we do, and I am sure this small brief introductory lecture about semen washing will help you a lot in your practice. And stay tuned with us. We'll be coming up with more of the embryology part in the coming lectures. Thank you.